Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Dr. Brandon Crawford. Dr. Crawford is an advancing neurological care with breakthrough non-invasive technologies that have helped patients with severe conditions regain functions from mobility to speech without drugs or surgery. As the inventor of the FDA-cleared 528i laser and the proprietary energy sensory movement method, Dr. Crawford has documented remarkable improvements across a diverse patient population. From professional athletes and celebrities to children and adults with traumatic brain injuries, his work has helped restore function, communication, and quality of life for many patients previously considered to have limited recovery options. And I could read this whole bio. You have a very impressive bio. I'm going to put it all in the show notes, but you founded the NeuroSolution Center. You've been a podcast host. You've been on the news. You're a speaker. You've done all these things. And I'm so grateful to have you on this show today. Thank you so much for joining me, Dr. Crawford.
Absolutely. Thanks for doing that. I didn't write the bio. That was the people on my team. So I appreciate them writing it and putting it together. But I hear you. It's like, I'm just a guy down here in Texas doing my thing.
It is very impressive. So anybody listening, do go check it out because you've got a good track record there. But I'm really excited to talk to you today because I've been doing some of the things that you do at your clinic, but not nearly for the length of time. And I don't have the expertise that you do. So I'm excited to pick your brain here today.
Absolutely. I'm excited for the conversation.
Yeah. So first off, my first question is always just kind of getting backstory. So what made you who you are today? How'd you get to where you are?
Gosh, yeah. So there's a long version that, might take an hour. I'll try and deliver it in the elevator pitch version. But basically, my trajectory was I always wanted to be in the medical field. I wanted to be a neurosurgeon, actually. That's where I wanted to go. But that changed whenever I actually had my own back injury. I had a really severe disc herniation when I was in high school, and then a failed back surgery, actually. And so my path has been quite interesting because fast forward, when I was in college, I got married to my high school sweetheart. And I'm a data guy. I like to look at patterns. I like to look at data. I like to look at statistics. And so when we got married, I started looking at the data of divorce rates in surgeons. And I was like, you know what? 80% divorce rate, that does not sound good. And so I'm also a faith-based guy. And so I started praying about, what should I do? And I was led back to high school when I did have that failed back surgery. And then I was hobbling across the parking lot afterwards. And the chiropractor in my town actually came up to me and said, "Hey, why haven't you seen me?" And I'm like, "Well, I don't know who you are. I come from a pretty traditional, medical family." So chiropractic wasn't even on my radar. But he offered to treat me for free, and because he said he felt led to do so. And so I went and I tried it out, and literally 2 weeks of being under his care, I was completely better. The pain was gone. This was a failed back surgery. Like, it was a big deal. So having that information, I went and I shadowed him, and I fell in love with this concept of chiropractic, but I knew it wasn't what I was put on the planet for. And so I actually had been accepted to pharmacy school at the point in time. And so I declined that, and I went to chiropractic school. My first semester there, I was in an impromptu lecture from Dr. John D'Onofrio. He was the president of the Functional Neurology Board. And he was talking about how our physical receptors in our body can change the central integrated state of our brain. And so I went up to him and I said, "Look, this is exactly why I'm here." And so he took me under his wing, and I became his protege. And that's what introduced me to functional neurology. And so I immediately started studying functional neurology. I've lived it. I've breathed it. I am a functional neurology, like that is my brain. That's all that I've really studied from an academic standpoint. And so what most people don't really understand is the difference in functional neurology and traditional neurology, because functional neurology is still a very young profession. And so we can talk about that. But, my path kind of continued to change because when I was an intern, I was working with Dr. D'Onofrio. There was a really interesting case, and it was a pediatric genetic brain disorder that does not really, the brain actually does not develop, that you don't develop the gyri in the brain. And I was asking him, like, what are we going to do with this? Like, we can't just activate the I mean, this is a genetic thing. What are we going to do? He said, we're going to take this laser and we're going to shine it on their head and it's going to help. And this was, 18 years ago. This wasn't really being done. And I thought, okay, well, this is your license, not mine. I'm the intern. So, okay. And so he did that, and the patient progressed exceedingly well. And we saw that brain develop in ways that it shouldn't. And so I knew, okay, this is absolutely why I'm on the planet. It's this combination of functional neurology with photobiomodulation. And since then, that has absolutely been my path.
Yeah, I love that. So it sparked so many thoughts when you were talking about that. And I love the way that people get into what you're doing because it makes you a more passionate person when you find that place that you're supposed to be. Because we all have a purpose here, right? We can't all do the
Hmm.
same things. But
That's right.
I had never really known about photobiomodulation until I got involved with hypercharge. That's what I was telling you about before we started the recording today, and just learning about how it works and how long it's been around. Like Michael Hamblin's been doing research on this stuff for years, and we just didn't have it
Hmm.
in practice. It didn't make it to mainstream. So how, for those that don't know about it, how does the laser work to actually help to restore function?
Yeah. Well, I typically like to kind of break down the word for people because photobiomodulation is a weird word.
Yeah.
So if you just kind of break it down, photo, light, bio, life, modulation to change. So it's changing life with light. That's literally, the translation for the word. Most people know photobiomodulation in the form of red light therapy, but it goes well beyond that. This can be any wavelength of light, leveraged for healing or any kind of biological enhancement, if you will. So what I always tell people, and I just ended a conversation or a presentation in Brazil. I was speaking at a medical conference with the concept of I don't want people to put this huge concept of photobiomodulation in this little box of red light therapy. Because this is so big and the implications are so far reaching that if we do that, we are missing the boat. But to answer your question, how does it impact the brain? I'm a neuroplasticity guy. Everything that I'm trying to achieve in my clinical practice is to upregulate and reestablish or establish positive neuroplastic change. So I think of the use of photobiomodulation in our clinics as a way to accelerate neuroplasticity. Now, for those that are not clinicians or trying to use it for other things, think of it like this. We have solar panels all over our body. They're called chromophores. And we have these chromophores deep within our body too. So just like solar panels work on your house, they're taking sunlight in and they're transmitting it into electrical energy. These chromophores on our body and in our body, they're receiving photons of light of various wavelengths, right? And it's taking the information and it's transmitting it into electrical and chemical signals. So we can use photobiomodulation to speed up healing. We can use it to reduce swelling and edema in the brain. There's actually good studies on that. It improves lymphatics. We can use it to enhance growth factors in the brain, to enhance neuroplasticity. The way I like to describe it is whatever that cell is supposed to do, when you use photobiomodulation, it's going to do it better. So it really just enhances cellular energy and enhances the ability of the cell to do whatever it needs to do.
Yeah. Yeah. So the two forms of red light that I've been exposed to and have more experience with now is the bed and the laser. Are all red lights created equal? I know that
Oh my
answer,
gosh,
but
no.
yeah.
No, 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 no. Actually, that's a big reason why I had to develop, the laser that I developed is because um, I like to talk about laser and light therapy. I finally found a way to communicate this, and it's comparing a laser beam to a voice. So if I were to start speaking to you like this, this would get very boring and frustrating. So we know that when we communicate with a voice, we can use how loud we speak, we can use our prosody of voice, we can use the intonation to help deliver the concepts and the information that the words are carrying with them. Okay? This is exactly true and equivalent for the laser. It's different parameters, but what I wanted to do is I wanted to better understand these parameters because I read some of Dr. Todd Obakaitis' work on how he uses photobiomodulation to activate certain stem cells called the V cell. And that really got me thinking. And so I want to control the duty cycle. I want to control the wavelength. I want to control the frequency. I want to control the polarization of the light. I want to control all these different parameters and better understand them so that the information being delivered to that individual is precisely created for the biological outcome that I want to occur. For example, if I have a setting in the laser that is supposed to help someone sleep, which I do, I don't want the laser beam screaming at my individual saying, "It's time to go to sleep. Let's go to sleep now," right? That's not how we want it. We want a nice calm. I want to reduce my duty cycle. I want to reduce the energy intensity of the photonic expression, right? I want to communicate the right information to that individual for that outcome. So I know that's a long answer, but the answer is no. Not all lasers and LED panels and all these things are created equal. Now, photons are good, right? So yeah, if you have an LED panel, use it. I'm not saying it's bad for you, it's good for you. And there's studies that show this. But what I'm trying to do is define the difference in precision laser therapy, like what we've developed, in a more generalized approach.
Okay. Okay. So you mentioned sleep. So are there different parameters for like sleep, for headaches, for mental
Yes.
illness? Okay.
Yes, absolutely. Like you just said, mental illness. Well, the longer wavelengths actually have deep implications for mental illness. Wavelengths like 975 nanometers, 1020 nanometers, 808 nanometers, like the longer ones, those are really good for that deep-seated depression, anxiety, those types of things. When we're talking more acute, sometimes I'll use the shorter wavelengths like the reds when we're talking about regeneration. So like long-term use of green and wavelengths like that really promotes stem cell migration, right? So there's different applications for all of these different things.
Cool. And then someone that's recovering from a TBI, for example, that hits near and dear to my heart
Mhm.
because of my own recovery. You have a wide variety of issues. You might have sleep issues, mental health issues, plus your brain is just trying to recover from that injury. Would you have different wavelengths that use at different times, or do you use a combination of them?
Yes and yes. So what people need to understand is even after a mild brain injury, there's this thing that occurs in the brain. I always like to describe it like when an ice storm hits Texas, right? It's called the energy crisis, by the way, in the TBI research. This energy crisis, just like when an ice storm hits Texas, everyone goes inside, turns on the heat, taxes the energy grid, right? When you have a brain injury, even a mild brain injury, this energy crisis exists, and you can get these rolling blackouts, right? And if some people come to me for years and they're stuck in this energy crisis phase, when we start to work with someone, that's why I created the energy sensory movement methodology. We go through that energy pillar first. We have to first address this energy crisis. So using the longer wavelengths of light initially is where I want to start. So if you use a longer wavelength of light, you deliver lower energy per photon. Okay. And then as the wavelength gets shorter, the energy per photon goes up. So if someone is prone to seizures, which would typically be that brain injured individual,
Mhm.
I don't want to use the short wavelengths to begin with because we see a spike clinically, we see a spike in seizure activity because we're delivering more energy per photon. And so I start that individual with the longer infrared wavelengths and then migrate them to using red and then even shorter wavelengths as we progress.
Very cool. Very cool. So when I was doing all my research on TBI recovery, and it all kind of went back to the mitochondrial level of dysfunction, kind of that mitochondrial paralysis, kind of like that blackout you were just describing. Why does that last so long in some people? Have you nailed that down yet?
Yeah, well, there's a few things going on. There's the flow reflow phenomenon, right? You get this initial injury, you get this reduced blood flow, you get this massive blood flow, and because of the disruption in the autonomics in these areas, that actually needs to be addressed first. And then side note, photobiomodulation modulates blood flow. So it's obviously huge for that, right? But if you're not getting adequate blood flow into the region, you're not delivering adequate nutrients, you're going to be stuck in this energy crisis state. The other thing that happens is that with a head injury, again, mild, moderate, severe, you get a disruption in the ion channels. And so this can actually continue to propagate. And oftentimes, what will come with that is what we call a channelopathy, where you can actually develop neuroautoimmunity to these receptors in these ion channels, which again propagates the energy crisis. So there's multiple reasons that someone can be stuck in this energy crisis, not to mention the fact that conventional care says, hey, if you've had a brain injury, let's put you under these fluorescent lights and tell you to, watch TV all day, right? That's not going to really be conducive to healing a brain. And so there's some things that need to shift in the conventional model as far as recovering from a brain injury. But yeah, there's a whole host of things that can keep someone stuck in that energy crisis. And I don't want to discount things like nutrition and hydration and things like that. Obviously, that needs to be addressed too.
Yeah. Yeah. And, traditionally they always said that most people recover from a brain injury in a month and people didn't have long lasting symptoms. And we now know that's much not the case. Like
Right.
30 some percent of people still continue to have persistent post-concussive symptoms. What, what do you find beneficial for people at the long term part of it? Do you see them getting better if they haven't really done much for years and they come in and they get this different treatments that you guys offer?
Yeah, so what I see, I've seen people fresh out of the hospital, and then I've also seen people 40 years after a brain injury. So I get to see, everything in between. The people that it takes a while to get here, right? There's a lot of what I call negative plasticity.
Mhm.
And I know that that terminology is debatable because, the argument posed to me is, well, if it was negative, well, it was just being accomplished so that they could live their life, right? I get it. But I'm talking about from a functional capacity standpoint, right? If someone has to develop a compensation pattern, the longer they have that compensation pattern, the harder it's going to be to overcome that negative plasticity to then regain what we would call normal function, right? Does that make sense?
Yeah.
So the sooner we can start working with someone, the sooner we can get them out of these compensation patterns. But I think the dialogue is changing quite a bit. It's really not really said that once a neuron is damaged, like it's not going to recover. Like that old way of thinking is pretty well gone by now. But when I started this, I've been doing this for 15 years now. Like that was the assumption. Like, oh, you have a brain injury. This is how it is for the rest of your life. And that's just not true.
Yeah. Yeah. I'm trying to fight an uphill battle, I think, with some of my colleagues now because I'm back in practice and I've had a lot of conversations with my colleagues in practice, and they say, well, it's after like 5, 6 months, they're not really having concussion symptoms anymore. It's now just them just not wanting to get better. And like, oh boy, like I'm almost exactly 2 years out here, and I can attest to the fact that those symptoms still continue. And for so long, people were told, well, at 1 to 2 years, that's it. What you got back is what you've got back. But what what we're talking about today is that you can't say that. You can actually continue to get better. And so I'm trying to open people's minds to look at all these things that might still help people outside of our traditional PTOT speech therapy that we would always recommend.
Yeah, absolutely. And I think something that is not discussed enough in brain injury recovery is the concept of the limbic system, right?
Oh,
The limbic system is really just trying to keep us safe. And it grades every type of experience as painful, pleasurable, or non-noxious, right? Nothing. And if we have a traumatic event of any type, that limbic system is going to remember that subconsciously. And so anything, any stimulus, whether it be a light, a sound, a smell, a thought, a feeling, anything that triggers the limbic system, right, that connects it back to that life threat event, it's going to sound the alarms. And that can look like anxiety, that can look like so many different things, right? So this concept of the limbic system in this healing journey is something that we like to definitely, talk through and help people with, because there's ways to actually shape and mold the plasticity of that limbic system.
Mhm.
We can access the ventral vagal system. We can access the prefrontal cortex, we can access the vestibular response, and all three of those areas have a huge impact on the vagal system and can help to rewire and plasticize these networks.
Yeah, yeah. So other than the red light, the laser, what other kind of things are you guys working on with patients?
So I've developed my own way to clinically examine someone, and it's the concept of developmental functional neurology. And so we understand that the brain is supposed to grow and develop in a certain order, right? We know that a baby is supposed to crawl at a certain age and talk at a certain age, and all of these types of functions correlate with brain network maturation. Okay, and so there's these blueprints built within our brain that is designed to develop our brain and our functions. Well, the cool thing here is that if you think about it, so we're developing this brain, and then all of a sudden, boom, something happens. It's not like the brain goes, oh, shoot, I don't know what to do. The brain goes, oh, no, I can't talk anymore. How did I learn to talk? How did I develop those networks to begin with? And so it starts using those blueprints. And the blueprints are actually pretty well defined. We have our sensory systems, our primitive reflex systems, and our postural reflex systems. And so just to kind of give the broad level overview, the developmental way that we check someone, we check their sensory systems, primitive reflexes, postural reflexes, core stability, vestibular function, eye movements, and cognition. And that's basically the order of care. A lot of those will work in parallel. But these early systems, for example, the rooting reflex, the palmar reflex, and the spinal reflexes, these are all connected with speech. And so if we're trying to help someone speak again, we'll check those and all the others. It's not like we're just looking at those. And then we go, hey, the body is telling us where to start and what to do. And that defines the therapy for that person. So we may start sensory integration and primitive reflex work and vestibular balancing, whatever we find in that exam, right? That's the concept of developmental functional neurology. And then what we're doing along the way is we're using those strategies as co-activation strategies. So we're activating these networks that have been injured or are imbalanced or whatever it may be. And then we're using the laser to actually stimulate these networks even more as we're activating them so that we can release growth factors and we can develop neuroplasticity in those networks faster and more effectively.
So without like giving away identifying information, do you have any like stories of really good successes that you could share?
Oh, absolutely. Let me just pull one. I mean, you can come into the office any day of the week and you'll find just an amazing story. Brain injury related, I like to talk about Cody. Cody Wall was in the Navy and he had some type of event happen. They don't know what, but he fell from a 3-story building, massive brain injury. Came to me still in the wheelchair and, barely able to speak, barely able to function that well. And now, here we are a few years later, he's actually now in school because he wants to do the same thing that we did for him.
Hmm.
So just this massive recovery. His story is somewhere in my Instagram page or in YouTube, stories and all that kind of stuff. Here recently, we actually had a really cool story picked up by national news, by Fox News. It was a baby with the diagnosis of lobar holoprosencephaly, a congenital disorder where the brain does not develop. She was missing about 90% of her brain. And most of these babies, don't live. The vast majority, like 90% of them or 95% of them don't live. And so they were advised to, start hospice care and this kind of stuff. And so I started working with her about a year ago. And, I was very upfront. I said, I don't know, but I do know neuroplasticity and I do know, how we can leverage what you do have to try and develop what you don't have. So we started working with her. And Now, I mean, baby Millie was just here, last week for the past couple of weeks, and we're working on crawling. She's able to say mom and dad. She's able to eat more. She's gaining weight now. She's like, this baby is thriving. She's not just surviving. And this is unheard of for this condition. Um, so like I said, I could go on, but yeah,
Mhm.
it's a fun ride.
Well, that's kind of cool. That gives me chills to hear about that. That's you don't see those things on in regular treatment.
hmm
Very cool. Um, how do you see the future of non-invasive neurology evolving over the next decade?
It seems like it changes on a month-to-month basis. I see there's a really big intersection in functional neuroscience with regenerative medicine.
Mhm.
I think that these two fields really collaborate well together, or at least from my experience, collaborate well together and really help to enhance each other.
Mhm.
So I think that that is a huge space for more growth and more opportunities for innovation. I think that when you combine, the use of stem cells or so, whatever kind of biologics you're wanting to use, and then you combine it with the adjunct of photobiomodulation, that's another amazing place for innovation. And that's some things that we're working on right now. We have a few clinical trials that we're starting. We've done our basic sciences, and now we're looking at, just how does different wavelengths of light and changing these modification parameters in the light, how does that influence the stem cells and various other things that we're looking at. It can also help us target diseased tissue or damaged tissue more effectively as well with those biologics.
Mhm. Mm. And uh, one other thing I wanted to touch on too, when I was looking at your website, you guys do intensives as
Yes.
well as regular treatment. Can you tell me more about the intensives before we
Yes.
start that?
So the purpose that I developed intensive care for our office was the concept of neuroplasticity. So if we want neuroplasticity to really develop and be sustainable, then we need adequate frequency, intensity, and duration of stimulus, right? It's like if you go to the gym and do 5 bicep curls once a month, you're not going to really change anything. It's the same thing for your brain, right? So we typically will see someone for 18 hours a week. Now, sometimes that's variable and whatever. And I've had people stay with me for a week. I've had people stay with me for an entire year. And we like to meet people wherever they're at. So we're as flexible as we can possibly be. And then at the end of that time, what we do is we create a home care plan so that they can continue to do these rehab strategies at home. But the purpose of that intensive care is to establish neuroplasticity. And I tell people to think of neuroplasticity like momentum. We need to gain as much momentum as we possibly can so that that will continue to progress forward, right? So it's not like you need intensive care all the time for the rest of your life. No, the goal is to kickstart these neurological processes and then retract, right? So that your brain develops and uses these blueprints like it was designed to do.
Very cool. Very cool. And if people are local, how frequently would you work with them normally?
So we're as flexible as we possibly can be, right? So if someone is like, "Look, I can make it in once a week for a couple of hours or whatever," we're like, "Okay, great." In between sessions, do X, Y, and Z, right? Ideally, if we can see someone 2 to 3 times a week, that's ideal. Again, but again, we just meet them where they're at because everyone's life is kind of crazy, and we do whatever we can.
Mhm. And there are three centers right now?
Yes, Austin, Atlanta, and Dubai.
Okay. All right. So nothing in the northern hemisphere over here.
Not yet.
Okay.
Not yet.
Okay.
I don't like cold weather very much, so
There's that. There's that. But
right,
we really need some red light up here.
right, yeah,
Where can people find you if they want to learn more about any of the things we talked about today?
yeah. So I've got a website that kind of has all the things I'm doing. It's drbrandoncrawford.com. My clinic here in Cedar Park is neurosolutionatx.com. My laser company, which is, I think, pretty cool to look at if anyone's interested, is 528innovations.com. Oh, and then Instagram. That's the coolest place because you get to see the patient stories. That's B Crawford DC on Instagram. So B as in boy, Crawford, D as in dog, C as in cat.
Awesome. Awesome. And I will list those in the show notes as well so people can find you easily there. Um, I am sure that I could ask you so many more questions, but I want to be respectful of your time as well. Do you have any last little bits of wisdom that you want to share with our listeners before we close up?
Yeah, first of all, thank you for, having me on. I really appreciate what you're doing for the community. And it's really important when someone like you with, you have great education, you have this great mind, right, is able to, I don't say it's great, but you had this experience that allows others to learn. And so, your place in this world is, amazing. And I'm very grateful for that. So, we've developed a motto in our office, and it's called Never Accept Never.
Mm-hmm.
And I would like to just leave everyone with that concept of never accept never, because everyone likes to say you can't or you won't or this is not possible, or they like to put these diagnoses on people and put them in this box. They say, oh no, you have this condition, therefore this is the outlook for your life. And I just want to encourage people that just tell those people thank you, but move on, right? Because you're not defined by your diagnosis. You're not defined by what happened to you in your life. So, just keep pushing and, never accept never.
I love that. Those are great words to end on. Thank you so much for being here today, Dr. Crawford.
Thank you for having me.
Yeah. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.